Hey people, wishing you all a successful day. Welcome to Tooth Spell. Let's learn science behind the art. Today I am here with you to talk about the blood vessel that supply and drain blood from the teeth and its surrounding. That is the artery which supplies blood and the vein which collects the blood. Starting with the artery which supplies blood to the teeth and its surrounding is the maxillary artery, which is the branch of external carotid artery. Let's see about external carotid artery first. External carotid artery is a branch of common carotid artery which is given off at the level of upper border of thyroid cartilage. From here it travels upwards and enters into parotid gland where it terminates at the level of neck of mandible. Through its course, it gives 8 branches: superior thyroid artery, lingual artery, facial artery, occipital artery, posterior auricular artery, ascending pharyngeal artery, maxillary artery, and superficial temporal artery. To retain, have words like Sister Lara facing OP at medical school. In today's video, we are going to see only about the maxillary artery in detail. Maxillary artery is the terminal branch of external carotid artery which is given off in parotid gland at the level of neck of mandible. To read and remember it easily, experts have divided this artery into 3 parts with the help of lateral pterygoid muscle. So, the first part is from the external carotid artery at the level of neck of mandible to the lower border of lateral pterygoid muscle, where it gives 5 branches. To remember, my anatomy lecturer has given me a secret. DAMAI. D-A-M-A-I. D is for deep auricular artery. As the name suggests, it supplies deep to the auricle, which is temporomandibular joint, external auditory meatus, and the tympanic membrane. A is for anterior tympanic artery, which supplies middle ear cavity. M is for middle meningeal artery, which enters the cranium through foramen spinosum. A is for accessory meningeal artery, which enters the cranium through foramen ovale. Both of these arteries supplies dura mater. I is for inferior alveolar artery, the artery which we play with. It enters the mandibular canal through mandibular foramen and supplies all mandibular teeth, and it exits the mental foramen as mental artery and it supplies chin. Before entering the mandibular foramen, it gives mylohyoid branch that supplies the respective muscle. The second part of this artery runs upwards, forwards, superficial to the lower head of lateral pterygoid muscle. Here there are 4 branches, which is MD has BP. MD has BP. So, masseteric, which supplies masseter muscle, deep temporal artery, which supplies temporalis muscle, pterygoid artery, which supplies lateral and medial pterygoid muscle, buccal artery, which supplies skin of cheek. The third part of maxillary artery escapes between 2 heads of lateral pterygoid muscle into pterygopalatine fossa. It has 6 branches, which is pig pass. P-I-G-P-A-S. P is for posterior superior alveolar artery, which supplies maxillary air sinus, maxillary molars, and maxillary premolars. I is for infraorbital artery, which enters inferior orbital fissure and divides into 3 branches: orbital branch, which supplies orbit, middle superior alveolar branch, which supplies premolar, anterior superior alveolar branch, which supplies maxillary canine and maxillary incisors. After emerging through face, it supplies lacrimal gland, nose, and upper lip. G is for greater palatine artery, which exits greater palatine foramen and supplies hot palate. It also gives branch called lesser palatine artery, which exits flexor palatine foramen and supplies soft palate and tonsils. The another P is for pharyngeal branch, which supplies nasopharynx, auditory tube, sphenoidal air sinus. A is for artery to pterygoid canal, which supplies pharynx, auditory tube and tympanic cavity. The last S is for sphenopalatine artery, which supplies nasal septum. So that's it with maxillary artery. The vein that drains teeth and its surrounding are pterygoid plexus of veins, which has tributaries on the similar name with the maxillary arteries branches. These tributaries collects blood from the teeth and its surroundings and drains into maxillary vein, which is located in the posterior border of maxilla, and it unites with the superficial temporal vein to form retromandibular vein. Finally, it's time to see the significance of maxillary artery and pterygoid plexus of veins in dental practice. Maxillary artery is very much connected to us. During root canal treatment, we are going to extirpate either posterior, middle or anterior superior alveolar artery or inferior alveolar artery. During extraction, we are supposed to arrest bleeding only from these blood vessels. And during periodontal free gingival grafting procedures, we should be more cautious about greater palatine artery, as we are not supposed to nick that artery at any cost. Finally, pterygoid plexus of veins is the culprit responsible for hematoma if posterior superior alveolar nerve block went wrong. So, these vessels should be handled with care and pampered during our clinical procedures to get success in our treatment plan. Thank you. See you all in this video. Bye.